Hi, it's Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma, January 7, 2021, COVID update. So, Oklahoma, a lot of cases. We had 8,000 over the weekend. We had about 3,300 and 3,600 the last 2 days. We had 62 deaths, I believe, yesterday and 39 deaths today. So big numbers. And they're just going to get worse because we're really feeling the pandemic occur now. So if you have the opportunity to get the vaccine, I'd strongly encourage you. There's lots of vaccine questions. First, it's safe for pregnant women. We believe it's safe for breastfeeding women. It's safe for anyone who's not had the infection within 3 months. It's a relative contraindication to get the vaccine within 3 months of the infection. It doesn't make much sense to get it within 3 months of a documented infection anyway, because you have neutralizing antibodies. I think the neutralizing antibody thing continues to cause disorder and confusion, but essentially once you get one vaccine, at 10 days, your immunity level is sky high, clinically 95% of the time. Laboratorily, by the definition that the CDC is using, 85% of the time. You then get the second vaccine, and by the CDC definition, your antibodies go high enough that they say you're going to be immune, but the data doesn't really change after the vaccine. So the bottom line is the vaccine, whether it's Moderna or Pfizer, is 95% effective in double-blinded trials. It definitely makes you, the Pfizer one, I had my second one on Tuesday, it's Thursday. I definitely felt achy and flu-like for a few days and a little bit exhausted. I think that's very normal. It means that you're getting an immune response. The first time I had a lot of shoulder pain and a little bit of the flu-like stuff. This time I had a lot more of the flu-like stuff because I probably am in the 85% who skyrocketed their antibodies. And so the second vaccine was it was a booster, but in some respects, I was probably doing pretty good. So I felt worse. But the good news is I'm now probably immune. I'm going to actually do something to prove it. I'm going to do a quantitative on my antibodies. You can always ask your doctors for that, which is going to make them go insane. But why not document that you have neutralizing antibodies? I know you're in the 95% and not the 5% who didn't respond. So that would be, a thought process. And again, this goes against CDC. They say there's no role for it, but I think there is a role for it because we're allowed to think, and thinking is important. And if you don't think, then what are you? You're a lemming. You're a follower. You're not someone who's taking charge of their life. So I would always encourage you to think and check your antibodies after you've completed your series of vaccines. For those of you who don't want to do a vaccine, good luck to you. I'm not going to criticize you. I don't mean it like that. I just think it's the smart thing to do if you're a higher risk person. I'm 56, I'm a male, I'm taking my vitamins and everything, and I've been exposed a bunch of times and I never got it, but who knows? That's the problem with it. It's Russian roulette. If you're a person who doesn't mind about a 1%, if you become symptomatically infected, risk of death, and about a 10% chance of hospitalization, and figure morbidity rates of either lung disease, cardiovascular events, or other associated things of at least 20 to 30% with the infection, that's fine. If you're a statistics person. But if everyone gets the vaccine, we knock it out faster, the society opens quicker, you can travel, you can do lots and lots of stuff. So that's why I would always encourage you to get the vaccine. I'm not promoting vaccines for people under 18. I think while they're allowed for people over 16, again, there was questions about safety for them because there's no data. And since it's pretty much a harmless disease over 99.999% of the time for those kids, I don't think the vaccine is probably a good choice, but that's my opinion. And that's really the summary. I take your vitamins right now. The COVID is running rampant. Oklahomans have been banned from Ohio and I think some more states because we're approaching 3 weeks of being the number one per capita infective area. So that's a problem. But eventually, on the bright side, once we get through this, we're going to have herd immunity faster. I'm being sarcastic. That's not the way to do it because we're having all these people who pass away. So that's not a good plan. Take your vitamins, get your vaccine. It's fine to get your vaccine in another county. I mean, there's a lot more vaccine accessibility in other smaller counties in Oklahoma County. So, and I know lots of patients who are going to other counties. You can call the Oklahoma County Health Department, which probably isn't going to do you any good because they're not very organized. Sorry, it's true. Calling it like it is, you can call a whole bunch of other counties, Logan County, Comanche, Cleveland County. Pretty much everywhere is going to have some vaccine now, and they're going to be periodically giving it out. So if you keep on calling, you can get on a list. Try to get vaccinated. That would be my number one message right now. Kim, what questions are there?
It's almost all about vaccines.
Okay.
So
I'll answer the ones I can.
Okay. After someone has received the vaccine, do they need to change or stop their supplement regimen?
No, I would continue on your supplement regimen. I think you have a 95% chance of being somewhat immune. You could probably, again, simplify it a little bit. Stay on your multi, stay on a fish oil, stay on the vitamin D. Still take the zinc a couple times a week. It's always good for your immune system. And there's other things besides COVID out there. And it's good for your hair, and it's good for your intestinal tract, and it keeps you uninflamed. The melatonin, again, keeps you uninflamed. It's good for sleep. So that one would be more optional. What other things? I think those are the main ones we talk about. There's a lot more you can do, but your core supplements in a normal situation, vitamin D, 5,000 units a day, at least one omega-3. I always like 2, but one's kind of the minimum. A multivitamin. Those are always your core. You then want to think about zinc. I think it's okay to take I like melatonin. I like turmeric. And there's a whole bunch of additional supplements, but we got to be realistic about what people can take. So I hope that helps.
Okay, so this person is confused about whether the vaccine is to prevent or to treat.
Oh, the vaccine is to prevent. Vaccines are to prevent illness. And so the data shows that there's a 95% reduction in infection rates in people who receive the vaccine over time. So it's prevention versus treatment. And remember, the FDA has not allowed really any pre-hospitalization treatment, which again, I strongly disagree with, as do many smart and intellectually driven academic physicians and researchers. So, everything I've done has been based on their research.
Okay. Can you still get or spread COVID after getting the vaccine?
If you're immune, no.
Okay. If you've already had COVID, should you still get the vaccine?
The current recommendations are you should get the vaccine, and it's recommended 3 months after your infection. Okay. I'm giving the CDC guidelines.
So this person had their first shot. They don't say which one they got of the vaccine, and they felt like they had a mild flu for 3 or 4 days. They're going to get the second one no matter what, but should they expect it to be worse?
Yes. Because I had that the first one, and this time it was worse. But it responded to Advil. There's some data that seems to indicate the Moderna vaccine is not as side effect driven as the Pfizer. But again, the Pfizer vaccine side effects. My arm was sore was this one for 3 days, and I felt a little flu-like on day 2 with the first one. The second one, I had no arm soreness at all, but I did feel very flu-like day 2 and day 3, especially day 2.
Okay.
But it responded to Tylenol and Advil, but I was exhausted yesterday.
If someone's taking ivermectin for prevention, should they stop any certain amount of time or at all before they get the vaccine? Will it interfere with the vaccine?
The ivermectin will not interfere with the vaccine. Your immune system is either going to respond or not respond. I think the theoretical question on the vaccine not working would be if you're on chemotherapy for cancer or potentially some biologic agents for rheumatologic disease, not Plaquenil, but I'm thinking IV chemos, and those would be questions to ask either your oncologist or your rheumatologist, or your GI doctor if you're getting it from a GI doctor for Crohn's or ulcerative colitis.
Okay, and then last one, how long is the vaccine effective?
How long is the vaccine effective? The million-dollar question. Well, I think it will most likely be effective for years and years and years and years, as long as there's not a significant mutation on the tip of the spike protein where the antibody works. So this is the spike protein, this is the antibody, it goes thunk and it inactivates it. As long as this little tip doesn't change markedly right where the neutralizing antibody bonds, you're fine. That hasn't happened yet. It has not happened yet. That virus mutates every third to fourth transmission. There's been millions of alterations in it, and that tip protein has still not altered. It may become a little more infectious. It may become a lot more uninfectious. We don't hear about those, but believe me, there's been tons of mutations that virus has gotten weaker. There is, though, of course, the one strain that we know is stronger, but it affects everyone equally. It does not predominate children or older people. It's a global increase in infectivity, but the protein spike where the neutralizing antibody binds is still there, so it still inactivates it. That is going to be a tricky thing if that happens, but ultimately it's reasonably unlikely. The thing to know about immunology, and I've talked about immunology a lot, and when we're thinking about innate immunity or cell-directed immunity or cell-mediated immunity, the beta or B lymphocytes are triggered to respond to the antigen on the virus or the bacteria, whatever, and they are trained to make the antibody to inactivate it. They are always going to be there unless you potentially get a lot of chemotherapy or something really odd happens to your bone marrow. So you are going to have the ability to produce the antibody to this virus once you're vaccinated for forever, essentially. I mean, there's some viruses that you look at hepatitis B, you look at measles, mumps, and rubella, you may need a booster at some point. But again, they usually last for a decade, sometimes longer. It's just the way they are. So yeah, I think there's the possibility you may need a booster, but again, globally, this is going to be an active immunologic protective strategy for you for years, unless there is a major mutation. And if that happens, they'll be able to figure out what the mutation is at the tip of the spike protein and probably fairly easily make a new RNA vaccine to that one that's very specific. So again, we'll just have to wait and see. Okay, good night. Be safe. Wash your hands. Wear your masks.